Well, Marlene, I wanted to kind of share with you some questions that some of our patients have asked us concerning the weight management program.
Okay.
Can you kind of tell us, what does obesity mean? When they say that I'm obese, what does that mean?
Technically, what that means is that your height and weight have reached a certain point where nationally and through medical standards it's dangerous for your health and can be the cause or precursor, if I may use that word, of many other illnesses like diabetes, high blood pressure, sleep apnea, arthritis, those type of things. Bringing the weight down can, if you have those and have developed those, can bring the management of those down to maybe just some medicine or coming completely off medicine. But those put you at a very increased risk for developing some kind of other chronic illness, because obesity in itself is now considered a chronic illness.
Okay. So if I were a patient and I signed up for the program, can you kind of walk me through what my experience would be with the program?
Okay, the first question that always comes to people's mind is, how much is this going to cost me? And so the answer to that is most costs are covered by insurances if you have insurance, and if you are a direct med clinic member, most of your costs will be covered as well. There may be a few costs that aren't covered. So then what we would do is we'd set up an appointment, you and I would sit down, and you would share with me what your concerns are, what you would like to do. We would very objectively look at your numbers, and that would include your height, your weight, which gives us your BMI. We would do your neck measurement, we do your waist measurement, and if you've had some labs done, we'd take a look at that. And then you would tell me, oh, I've been experiencing this pain, these pains in my hip or my knee, or, you know, I've been peeing a lot. And so we would investigate that, because what I'm looking at are symptoms of arthritis or possibly diabetes, and we would take that all into consideration. Then we would talk about food choices. We would talk about a weight loss plan, if that's where you want to do. And then what we would talk about is different activity options, because not everybody likes to do the same thing. I try not to use the word gym, because everybody thinks activity.
No way.
I need to go to the exactly, and so I just say activity, right? And then I also talk about stress management. Stress management is very much involved with weight management, and sometimes I think that the amount of stress we see in our lives is partially really tied into the amount of obesity and illnesses that we're seeing these days.
I agree.
And then we would set up a program, and if you wanted to come in a couple times in the beginning for a few months, we could do that. And then would like to see you at least a month, and we would take it from there. Okay. Medications are always an option, and we would talk about that as well.
Okay, all right. If I wanted to get started on the program, how would I get started? How would I enroll in your program?
Okay, you would, one of two ways. You could call our clinic and make an appointment, or number two, online. You would sign in a chat there, and we could get you signed up for an appointment. If you're an existing member, and I've had people come in that I've been treating for diabetes and that, and they said, hey, look, I'd like to come and try that program. So the door's already open there, but the first step and the hardest step is coming in the door. So just make an appointment, and we'll take it from there.
Wonderful, wonderful. Well, I'm looking forward to outcomes at the end of the year, how we're doing with our weight management program. Okay. And we hope that we have some activity from potential patients that would like to come and participate in our program. Thank you.
Thank you.